Naomba watu waweze kusonga mbele. Hapa penye Alfred alikuwa amekaa kwenye mwisho. Tafadhali naomba kwa sababu mchana alifanyi.
I like that harmony vile tunaimba. Now, I think the last time tulikuwa hapa, somebody suggested how do we, for the ladies, basically, how do we examine our breasts? I made some photocopies here. I don't know, how many are we ladies? We are many. I don't know, sijui kama hizi zitatosha, but I promise, wale ambao hawatapata, I will make sure I make other photocopies, nilete pastor, so that he can distribute. Sasa sijui nani atatusaidia. For the ladies and for the husbands, of course, they can also take for their wives, so that we learn how to examine our breasts, ladies' breasts for that matter. Rarely, very, very rarely do men have breast cancer. Very, very, very rarely. Tafadhali andikeni, write your questions about anything about reproductive health, that is female, and then I will answer the questions at the end of today's session. So to recap about what we talked about last week, not last week, on Monday. On Monday tulizungumzia, basically we talked about some heavy periods, some patients have heavy periods, painful periods sometimes. To somebody there was a question about using contraceptions, whether it is okay, and whether contraceptions can be used in young ladies, where the young ladies are, 15, 14 years old. And there were also other issues about using P2, that is the morning after, inaitwa morning after pill, whether use of the P2 and using it frequently can have an effect on your reproduction. And I say yes, using P2, P2 is supposed to be an emergency, and you cannot have an emergency every week, every 2 days. So use of the P2 and using it that way will actually distort the biochemistry which goes on in the female body, and it can have consequences later on. So there was a suggestion that today we talk about fibroids. And I think the other suggestion was to touch a little bit on infertility as well. And about breast, how do we examine the female breast? I think the number three, we have sorted it. We have pieces of paper. I was not able to laminate them, but I will try next time, such that for the others who don't get, they will get something to have. Fix this in your bedroom or in your bathroom, such that you can be able to do that on a daily basis, especially after the periods. That is when we can examine our breasts. It's the best time to examine your breasts. So I want to touch briefly about fibroids, because that is a big problem in this part of the world. I'll talk a little bit about infertility, which is also a big problem in this part of the world. Alafu maswali tafadhali andikeni, such that we can be able to deal with them as we go along. What are fibroids or what are fibroids? Inategemea unatoka pande gani. Wengine wanaita fibroids, wengine wanaita fibroids. Is neither here nor there. Ama wengine wanaita myoma, ama leiomyoma, ama myomata. It doesn't matter. Hiyo ni yetu, lakini in general they are called fibroids or fibroids for that matter. Fibroids affect women who are in the reproductive period. What is the reproductive period? From around the time a young lady starts having her periods, she's actually in the reproductive period. So when a young lady starts having her periods from around 13, wengine wanaanza around 12, rarely, but around 13, 14, 15, that is the majority. That is the reproductive period. And it goes on until the 40s, slightly over 40, even if it is a little bit difficult for ladies who are over 40 to get pregnant, but they still can and they do get pregnant. So fibroids affect ladies in the reproductive period. Once we have got to the menopause, the fibroids, if they are there, they shrink or they disappear. So what are they? Fibroids, when you look at the structure of the womb, it has muscles. It's what you call smooth muscle and skeletal muscle. But in the womb, it's basically smooth muscle. Now, there is, remember we talked about the periods, how the period starts, ladies, day one, when your period starts, it is because of the action of, or the release of, what we call estrogen from the ovaries. Now, this estrogen will work. Remember I mentioned that estrogen is what makes ladies be ladies. Think like ladies, look like ladies, behave like ladies. And testosterone is what makes men be men. Have a deep voice, have muscle, be more aggressive. Now ladies here, we are a little bit more toned down, as it were. So it has been noted that basically it's the action of estrogen on the smooth muscle, which makes parts of the smooth muscle to grow, and they form fibroids or fibroids for that matter. Now, 40 to 60% of women of African descent, meaning Kenyans, Black Americans or African Americans for that matter, Cuban who are Africans, who have African descent, and so on and so forth, will have fibroids in their lifetime. So 40 to 60%, which is a very, very high number. For example, if we take 100 women who are here, about 4 of you, is it 40 of you? 40 of you will have fibroids, 40 to 60, which is very big, all right? Now, fibroids have different sizes. They can be from 0.5 millimeter all the way to several centimeters, 20 centimeters, and so on. There is a time we operated on a patient who had a fibroid which was 6 kilos. Kwa hivyo tulitoa akaslimu 6 kilos straight away. It was that big. But they can be small and there can be many of them in the womb. Now, a friend of mine, my colleague, did surgery and he removed 140 fibroids from a lady. 140.
The much I have done, I have removed, I think, 70 or 80. Kwa hivyo record ni yake. So the fibroids can be many. Now, when we look at the womb, there is that place. You remember we talked about a balloon where we blow in, that was the cervix, and then where the air goes in and creates, and the balloon goes, and let's say that is the womb, or that is where the baby implants. So. Now, fibroids can be formed in any part of the womb. They can be in the cervix, here where we, remember what I told you, where you blow in. They can be in the womb itself, where the baby grows. They can be outside the womb, where they can be hanging, or they can also be in the muscle of the womb itself. So you may have a patient who has fibroids which are outside the womb, for example. Or you may have a patient who has fibroids which are outside the womb and in the muscle of the womb itself. Or you may have one who has in all the places, outside the womb, in the muscle, and in the what you call the cavity. That is where the baby grows. Okay? Now, depending on where they are, there are different names to them. So you may find the ones which are outside, they are called pedunculated because they are hanging. But the pedunculated can also be in the cavity and they come dangling down into the cervix. The ones in the muscle of the womb, they are called intramural, that is in the wall of the womb. And they are the others which can be what we call subserosal, meaning they are in the womb but almost on the line, on the outside of the womb. How do you know that you have fibroids? How will you know that you have fibroids? Most ladies will have no idea that they have fibroids. They may have fibroids which are small, so they don't affect their reproductive life at all. Some others can have small fibroids but will have serious symptoms. For example, if you have a fibroid in the cavity where the baby grows, you'll find that these ladies have very heavy periods. And that is one of the questions we ask. Do you have periods? Yes. How are your periods? All my periods are heavy. What do you mean they are heavy? And then we ask, of course, come gynecologists, we know all the type of pads that ladies use. Cortex, UND, zote tunazijua. So we ask, which pads do you use? Oh, I use this size. Aha. How many of them do you use in a day? I use 5 of them, 6 of them. And sometimes I need to get something extra so that the flow does not embarrass me. And others say that even with the extra, towel or whatever it still flows. So that is an obvious sign, okay? But by and large, most of the time, may not have any symptoms. So heavy bleeding is one of the signs and symptoms. Do you pass any clots? Kama nyama hivi zinatoka. Ideally, during the periods, there should be no clots. Ideally. But sometimes they are clots. So we ask, how are these clots? Hizi clots zinatoka ni nyingi, and then when you put the two together, heavy periods plus clots, we know there is a problem. Do you have any problem during intercourse, for example? Because if the fibroids are big, sometimes they can be a hindrance when you're having intercourse. You find that there's a discomfort, or sometimes you just don't want to have intercourse. So that can also be a sign. The other thing is that sometimes if they are big, you may have lower back pains. Why? Because the size of the uterus is big and it stretches what we call ligaments, because the uterus is anchored to the back. So it stretches those ligaments and you will have this lower back pain. The other question we ask, when we go to the toilet, when you do a short call, how does it feel? They will say, some of them will say, when I feel like I must go to for a short call. When I go there, whatever urine comes out is little compared to what I was feeling. And then after a short time, I feel like going back. And when I go back, the same thing happens. So you know there's a problem there, because may find that this fibroid is actually pressing on the bladder. The bladder is in front. Okay, so that is also another sign. The other one is when you go for a long call, you feel like you have to go, and when you go, whatever comes out is also not as much as you expected it to come out. And then you also feel like going back, and when you go back, the same thing happens. So you may find that this fibroid or fibroids are actually pressing on the rectum or on the large intestine. So heavy periods, and now when there are heavy periods like that, you may also have other signs and symptoms. You start feeling weak, you may feel dizzy, and you feel like you don't want to wake up. Why? Because you have lost so much blood that your blood level has actually come down. So that is also something that we ask when it comes to fibroids. So you have come with this problem that Taria have heavy periods, clotty periods, and so on. So immediately you say that, I'm thinking about possible options. It could be this, it could be that, it could be that. So when I take the history, when I talk about the heavy periods, clotty periods, the number of pads that you use, and they are all soaked and so on. So I think I have about 50% of the diagnosis. So the rest now is basically to confirm whether what I'm thinking about and what you have told me is actually what it is. So we will send you for a test. If there are very heavy periods, we send you for a blood test. Why? Because we want to see whether your level has come down when you're having your periods or not. And when you have those signs of dizziness and feeling weak and so on. So we need to check your blood level, what is called hemoglobin, or full blood count for that matter. We will send you for a scan, an ultrasound scan. And the ultrasound scan can be done in two ways. Most of the time you'll be told, enda unywe maji mengi, alafu rudi. Sasa, ukae tu hapo ngoze. Once you feel like you really want to go to the toilet, then come we do a scan, where we do a scan on the abdomen. That one helps us to see and to localize the fibroids, the number, and the sizes. Sometimes, or even better still, we actually do a transvaginal scan, meaning we take an instrument called a transducer and we insert it in the vagina. This is more accurate than the transabdominal one. Why? Number one, it does not need you to drink any water. Number two, we are very close to the cervix and to the womb, which we are supposed to examine. It is more clearer and it is more accurate, because then we are able to see and localize, especially if the fibroids are many. It can be a problem when the fibroids are big, because we can insert in the vagina and we actually do not see. We can see, yes, there is a structure in the womb, but we can't see how big it is. So we may do a transvaginal scan and a transabdominal scan at the same time. Now, once we have this information, we will now know, yes, Joanne has fibroids, and these fibroids are located here and there. How many of them there are, and what are the sizes. So now, once we have this information, together with the history that we took right at the beginning, we can now sit down and say, is this a problem to you, or it's not a problem? Because sometimes some patients have fibroids which are 10 centimeters, but they don't have any symptoms at all. So do you need to take them to theater? No, you don't. Must you have them removed? No, they're not affecting you. So unaendelea na maisha yako. So we can come back after about 6 months and do another scan again and see whether the sizes have changed, or whether there are more fibroids and so on, and whether there are any other symptoms which have occurred during that period. Now, let's say we have seen these fibroids, we know where they are and the structure, and actually they do affect you. They are very heavy, and they actually, during that period, you lose a lot of blood. Then here we have to tell you then, in this case, we need to do something about this, because losing a lot of blood every month is not good for your health. So we will need to take you to theater. There are different methods of operation. Number one, the first thing we want to find out, have you had enough children? Because there are patients who come, they have fibroids, but A, they don't have children, or two, they have maybe 1 or 2 children, but they want maybe 4 or 5 of them. So that is the first question we ask. Have you had enough children, or you want to have more children? Based on that, it will help us decide what type of operation we are going to do for you. There are different approaches when it comes to surgery. Let us say, for example, that you don't have enough children, or you don't have a child at all. So our approach will be to remove the fibroids alone, not to remove the wound. So. Now, again, it depends on where these fibroids are located. If the fibroid is located inside the cavity, where the baby usually grows, okay? So the type of operation will be different. That one, we can do what is called hysteroscopy. What does that mean? It means that we take you to theater, and we do not cut, we do not open the abdomen at all. We do the surgery through the vagina. So we insert the camera inside the womb, and then we can see what is there, and we can use an instrument to either chop that fibroid that is there, or fibroids that are there, and then after that you go home. A very rewarding operation, because most of the time you stay in hospital for maybe 1, maximum 2 days. But if the fibroids are in the muscle, or they are outside the womb, then we may need to do 2 things. We may need to cut the abdomen. Usually we cut across, but sometimes we can cut, longitudinal wise. Why? On what does it depend? It depends on the sizes. We have seen patients who, Wakilia, you look at her, you think she's 40 weeks pregnant. Because the womb is just full of fibroids. Then that one we just have to cut longitudinally, because then we have better access to the abdomen and an easier way to remove the fibroids. But most of the time we cut across. Then we do what is called a myomectomy. That is basically removal of the fibroids alone. Alright? Now, again, depending on the size and the location, we may do what is called laparoscopy. So we do laparoscopic myomectomy. What does that mean? Remember the one I told you about opening? That is called laparotomy. And the other one is scopy, looking. So the laparoscopy, we make small incisions. One small incision hapa kwenye kitovu, and 2 or 3 others on the side. So we go in with a camera and some instruments. So we are operating inside the womb, inside the abdomen, but we are not looking inside, we are looking at a screen. So we are operating here, but we are looking at a screen. And we have a camera there which we can actually come very close to wherever we are operating. It's very, very, very accurate. What are the advantages of laparoscopic myomectomy as opposed to laparotomy? In laparoscopic, when we do that, usually we do that when the fibroids are filled and the location is also okay. Because sometimes they can be right at the back, and access to get them can be quite difficult, and we may jeopardize your life. So that one we don't do when the fibroids are located in a difficult place. So the beauty of laparoscopic myomectomy is that the patient will go home after a day. In the UK, for example, you do that in the morning, in the evening you go home. Here, because of insurance, some of the insurers think if we do that, that actually wasn't serious surgery. So they won't even pay for you. So usually the patients will stay in hospital for a day, maybe 2 days. Okay? In the cut, the laparotomy, the patient unfortunately stays in hospital a little bit longer, maybe 3 days, assuming everything is okay. And then when the healing process starts, sometimes you may have a few complications in that things can get stuck inside the abdomen, what we call adhesions. So we try to balance and see where the fibroids are, and what the sizes are, and what is the best option of treatment. There is also another method of treatment without opening, either cutting or even putting a camera, and that is called embolectomy, what we call the uterine artery embolysis. What does that mean? It means that we look at one of your major veins, and then we go through them with an instrument, and we go and block the blood supply to the womb. And when we block that blood supply, that fibroid will slowly shrink, and it will stop, it will stop disturbing. Other methods, of course, are there. There's something which is new in the world. It is called HIFU. HIFU is high frequency, high intensity frequency ultrasound. What does that mean? It means that once we've located these fibroids, we don't cut or we don't do anything. We put you on a bed, and then there is a machine which produces high frequency ultrasound. And these are guided, they're like laser. They go and they burn the fibroid where it is. A very convenient way of treatment, but again, it's not for everybody. We have to have few fibroids, and the location is also important. In Africa today, we have three such machines. There is one in Egypt, there is one in Nigeria, and one in South Africa. There are some people who want to see whether they can also bring such a machine in Kenya. Of course, it will be a very good way, because it will be another method of treatment of fibroids. In summary, fibroids affect quite a number of women, about 40 to 60%, women of African descent. They can be of various sizes, and the location can be also all over the womb. The symptoms are not always there. There are some women who will have fibroids and they don't have any symptoms. But some of the women who have these symptoms, who have the fibroids, can have symptoms like very heavy bleeding with clots. They may have dizziness, lethargy, and so on. They may also have issues when they go to the toilet. They feel as if they are pressed, but little or nothing comes out. And in terms of treatment of fibroids, there's a surgical treatment which I have talked about, where we can open the abdomen, we can put a camera on, or we can stop the blood flow from going into the womb. Sometimes we may start with medications if the patient is not ready to go for surgery. So we give medications, pain medications, to build up the iron stores and so on. Sometimes you can even use a coil, but there are two types of coils. There's a coil which is impregnated with a hormone, which will actually stop, the flow for some time. So, if you have any issues, any questions about fibroids, please feel free to write that question down, and I'll answer it shortly. Don't limit yourself to fibroids. Just write whichever question you have. I'll talk briefly about infertility. We are about how many people here in the church today? An approximation, 200 maybe? About 300, About 300. Okay. Now, when we talk about infertility, how many of us know of somebody who does not have a child or children? Let's start with our families, just our families. In our families, do we know anybody who does not have a child? How many? Let me see your hands. Okay, so these are the villages. Just hold up your hands. So these are the members who have somebody, who knows somebody in their family side. Alright? What about friends? How many of us know of friends who don't have a child? Let me see. Okay? So let's put up our hands. The ones who know about family and the ones about friends. Let's see how many of us are here. Okay? Almost 3/4 of the church. What about those ones who have heard about somebody who does not have a child? That's it. How many have had? Not many of us. Okay. But 3/4 of the church know either a family member or a friend who does not have a child. Now, when it comes to infertility, it is defined, this is my pet subject, by the way, and it is defined, there are 2 types of infertility. The first one is where a couple does not have a child. It is called primary infertility. Pastor, how much time do we have? Primary infertility, because we can talk to you tomorrow about infertility. It's primary infertility. And primary infertility is defined as a man and a woman are in a relationship. It doesn't say get married or whatever it is, are in a relationship, and they have, I think we're all grown-ups today, isn't it? We're all grown-ups? Okay. They have sex. Kanisani hatusikiangi hiyo jina, si ndio? Leo mnalisikia. They have sex 2 to 3 times a week, and 1 year has passed, and they don't have pregnancy. That is primary infertility. So a couple, 2 to 3 times a week, 1 year has passed, and they're not using any contraception, and there's no baby. That is primary. Secondary, again, it's the same thing. A couple having sex 2 to 3 times a week, but they have a child or children, or the lady has been pregnant before, and now they're trying to have another conception. And 1 year has passed, and there is no conception. There is a caveat to this, that if this lady, again, primary lady, if this lady is more than 35 years, then that time of 1 year, that period of 1 year, is actually shortened to 6 months. And then the other caveat is that the lady is not breastfeeding. Komana, breastfeeding actually does act as contraception sometimes or most times. So primary and secondary infertility. Now, I asked how many of us have had or know some or family member who has issues with getting a baby. 3/4 of us lifted up our hands. What is the scale of this problem in this country? Generally, in Western countries or well-developed countries, infertility affects about 8 to 9. Conservative estimates inasema kwamba 15 to 20% of the Kenyan population have issues with infertility. 15 to 20%. Now, when you talk about 15 to 20%, it feels like, what is 15 to 20%? I want to break it down for you. If we say today that the Kenyan population is 50 million, let's work with 50 million. Could be slightly more, slightly less. Let's work with 50 million. Tutoe watoto, let's say watoto are 25 million. Tumebakia na watu wazima who can reproduce as 25 million. So let's work with this population of 25 million. Let us work with, let's say 20%. So 10% of 25 million is that. What do I say? So 10% of 25 million. Watu tunatoa tithe hapa, tithe ingekuwa ni pesa ngapi? Sorry? No, it's not 12,500. Umeanguka mtihani. How much? 10% of 25 million. Sorry? Umeanguka. 10% of 25 million? 2.5. So 10% of 25 million is 2.5. Sawa. Tumesema we work with 20%. So 20% will be how many people? 5 million people. 5 million people. Now, who knows the population of Nairobi? That's approximately. How much? 4 million. Anasema 4 million. Anasema is 3.4 to 4 million. Let's work even with 4 million. Sawa. It would mean that everybody who is in Nairobi actually has a problem with having babies. You see the scale of the problem? And not only Nairobi, we need to throw in a few other counties. Kama gani, hapa karibu, Kiambu, weka ndani, waingie, watusaidie. Kajiado, and Machakos. So imagine the whole of Nairobi plus Machakos na Kajiado. Watu wako na shida ya kupata mtoto. Is it a small problem? A big problem. Imagine wakati wa COVID, what happened? Wakati when they discovered that one person has COVID, what happened? Sisi nisema, tulifungiwa njia, tukafungiwa sivini, and whatever. And every day there was a report. Mwangangi, alikuwa anaitwa Mwangangi. Today, the COVID, our numbers have gone up by whatever. Until we got used to her, Mwangangi or COVID. Do we talk about infertility? No, we don't. Why? Because it is a stigma, especially in our society. Sisi wa Africa, it is a stigma. Never talk about infertility. Kwamba mzee yuko na shida, mama yuko na shida. And by the way, ladies and gentlemen, statistics show. What do we think? Who is the problem, the bigger problem? Is it the ladies or the men? Sorry? Haya, wale ambao wanafikiria ni kina mama, mikono juu. Mnaogopa. Wale ambao wanafikiria ni kina wazee. Na wazee wengi ndio wazee wamenyamaza. Oh, the ladies leave the men. Actually, about 40% or slightly more of the problems of infertility ziko kwetu. Ziko kwetu. Ziko kwa wanaume. Naona kama mama mshuka. Yes. Now, why is it that men have a bigger proportion of the causes of infertility, but it is women who are looked upon? Kwa sababu gani? Ile kazi inafanywa in the bedroom. Who manifests the fruits of that man? So if the one does not manifest the fruits of that work, which is being done behind the doors, yeye ndio yuko na shida. Sawa sawa? Yeye ndio yuko na shida. I want to tell you a story. 3-4 years ago, I used to work in Nairobi Hospital. I used to work there on Mondays. That story ni nyingi tu, but let me just give you an example of this one. Just to show kwamba sisi tunafikiriaga ni kina dada, lakini sisi ndio tuna shida. I met a gentleman there, came to see me, and I arrived there a little bit late. Kama leo nimechelewa kidogo, sio mbaya. I was somewhere else and I went there. When I reached the gentleman, was very agitated. Daktari, where are you? Tunakungojea hapa sijui nisema samahani sana, but I was working elsewhere. So anyway, when it came his time to get into the consultation room, so I started asking questions, all these, whatever. Ikafika mahali, because that's a question we ask. Una watoto, una mtoto, una watoto? I said, yes, niko na mtoto. Oh, okay. Watoto wangapi? Had 4 children. With the first wife. And he's married to a second wife. The second wife came with a baby. But she's expectant. 6 months. So he has 4 children. Second wife is expecting 6 months, and she came with a baby. So technically, ako na watoto wangapi? 6. Lakini wale wake ni wangapi? 5. So I asked myself, why are you coming to see me? You have children. Anyway, he gave me a sperm test results. The sperm test results showed that he had no sperm. So we talk about these things. Ambassadors they learn about this in school. So ambassadors, that is where you came from. You came from sperm and eggs. Okay, so now this gentleman has technically 5 children and he has no sperm. Does that make sense? It doesn't. So nikamuuliza anacheza wasikia. Anyway. Nikamwambia, it may be that the lab did not do a good job or whatever it is. So akaenda haraka sana, another lab, The following week he was there with the results, the same results, zero sperm. Akasema okay, daktari miracle, mwingine anasema miracle baby huyu. Anyway, ikamwambia we can do some other tests as well. Let's do a blood test. We look at hormones and we do a scan of the scrotum, of the testicles. So I sent him, akaleta majibu after another week. So what the results showed was that his hormones were very low. And hormones are basically what make our bodies work. Remember we talked about estrogen, testosterone? Yeah. So they are removes a little bit of tissue from the testicles. Now that is sort of looked under a microscope, and we can actually tell where the problem is. So he did that, and the result came that it was what we call primary arrest. If, for example, tukizaa mtoto si anakuwa anaenda primary school, anaenda secondary school, anaenda university, ndio anakuwa mtu mkubwa, sio? So the same thing happens with sperm. They also grow. There are different stages of development. So in his case, yake ilikuwa ile ya primary, ilikuwa mia hapo. So he was not producing any sperm. Watoto wako na wangapi technically? Number 6. How? Now, akaniuliza daktari, what do we do? What more can we do? I said, there is nothing much you can do. We have done all the tests and they all come back kwamba kuna shida. And then I asked him, you have these children, why did you decide to go and do a sperm test? Akasema, you know, some years ago I was in a relationship with a lady for 2 or 3 years, and then we broke up. When we broke up, this lady told me, kwamba wewe hauna kitu, you are an infertile. Kina mama. Anyway, so what this lady told him was actually eating him at the back of his mind. Kwamba niliambiwa kwamba mimi ni mwanaume tasa, and there is something, but I have children, so let me just go and check. So he went and checked, and unfortunately, it confirmed kwamba yeye alikuwa ni mwanaume tasa, but with how many children? 5. How many? 5. When you talk about so a very sad ending. Akaniuliza, so daktari, what do I need to do? Unfortunately, there is nothing that we could do for him, because he was actually not producing sperm at all. So I had to try and find a way of relaying this message to him. You know, when we have children, you can be, there are 2 fathers generally. You can be a genetic father, biological father. Ideally, you should be a biological father. Kwamba wewe ndio zako, DNA material ndio imezaa akatoto. Sio? Number 2, you can be a social father. Kwamba you are the ones who's taking care of the needs of these children. Na wewe ndio wanakujua kama baba yao. Wewe ndio unawalipia school fees, nguo wewe ndio unawanunulia, chakula wewe ndio unawanunulia. So you are you are still a father, but you are social. It is good if you are both a biological and a social father. But in this case, whether you are a social father. I don't know how to help you, but you need to talk to somebody. You need to talk to a counselor. So that you bring out these issues out. Unfortunately, I didn't see him again. Gentlemen, let me tell you something. Hii ni kwa wanaume. Dada, mfunge masikio tafadhali. Amusikie. And I see that every day. Gentlemen, if these ladies want to have a baby, they will have that baby. Kwa kanisa hiyo haitendeki, lakini anyone else hapa tuko ngangari. But I listen to stories of what couples do, especially weddings. Na sisi wanaume tunaingizwa kwa box kama ile kondoo inaenda kuchinjwa, na tunaingia hata tunaelewa na tuulize maswali, tunapangwa karata left right bila kujua unafuta unaingizwa box. Hiyo story mention. Another couple came to see me. Jamaa anafanya kazi somewhere out of the country, and they said, you know, I'm not going to be around, so we can give sperm, we freeze it, because we can freeze sperm, we can freeze eggs, we can create embryos, that is the beginning of a baby, and freeze it and so on, and freeze it for 5 years, and up to 10 years. We can even choose the sex of the baby that you want. We can, if you, in the family there are some hereditary problems, some diseases, we can actually try and find out whether those embryos have that disease and so on. But that is the technical piece. So this couple come to me and say, no, I'm going to be away, so kawambia toa mbegu tuzi ifanye kwa barafu. Alafu wewe, I'll remain with the lady. So that's what they did. So the idea was to treat infertility because they had one baby, they wanted another, or they wanted others. So kwa sababu when the lady is going to be ready, the man is not here. But at least we have his son. So yeah, kind of. So the lady disappeared. After some time, she came to see me. So the first question I asked is, when was your last period? When was your last period? It was a date there, which was 9 weeks ago. I said, okay. The next question when we have such is, have you done a pregnancy test? I said, yes, I've done a pregnancy test. I said, oh, fantastic, congratulations. But then she asked me, she said, Doctor, I came to see you because I need your help. I said, okay, what kind of help do you need? He said, you know, I said, yeah, I know we have frozen sponge. He said, yeah. But what I did, nilienda nikaangalia. I put my eyes on somebody. Ile song inasema I put my eyes on you. So she put her eyes on somebody. Lakini nikwambia wanaume tunacheza kwa karata. So this guy, of course, this lady started a relationship with him. Now akapata mimba. So nikamuuliza, so what is going to happen? Are you going to tell that guy? I said, no. The guy doesn't even know. And what about your husband? He said he also doesn't know. But, nimemwambia kwamba we did that process that we had talked about. Kina nada. Now, anyway. So nikamuuliza, so how do I come in now? He said, but I need your help. Just in case my husband asks, what happened? Mwambie tulifanya ile process. Nikamwambia, you know, I can't lie. I can't lie. Maybe the person we have somebody in the lab called an embryologist, maybe atabadilisha ile on the procedure sheet, asema kwamba tulifanya. And in the meantime, you know what she has done? She has told the husband, I'm expectant to define ile process, tafadhali tuma pesa 40K, so that you can pay for it, which I borrowed. Pango karata, jamaa katuma pesa, he was very happy, kwamba the process succeeded. Anyway, she disappeared. You know, have intercourse, 3 times or 4 times in a night. You can't. So what do? Tunameza kakitu. So it gives you the energy, it gives you the strength, and you can go on. After some time, ako kakitu, the blue tablets stops working. And you're 28, you're 29, and you have a girlfriend, or you're planning to get married, you're raising someone. Unajaribu Hakuna salute, kila kitu. So what happens? And let nobody lie to you. Women love sex. That is the truth. Women love sex. It's not only men, women do, and they love it. So long as they get the right person. So when a young man gets to that stage whereby he cannot be able to satisfy this young lady, of course, we have issues with what we call retrograde ejaculation. But instead of the sperm coming out, it goes back into the bladder. Yes. Unaweza wakazaliwa hivyo sometimes, but we can sort that out. That is not an issue. We have issues with the quality of the sperm because in that ejaculate, we look at the volume, we look at the number of sperms, we look at how many of them are normal because out of those 100 million, we only want 4% ziwe normal. Just 4%. So if you have 100 million, 4% itakuwa ngapi? Watu wa hesabu. 10% itakuwa 10 million, so 1% will be 1 million, so 4% will be 4 million. So you just want 4 million. Hizo zingine zikae tu ni sawa. So you want 4. But sometimes even getting that 4% is a problem. So. And then we have issues about food, our lifestyle, the way we eat and what we eat. Sisi tunakula asubuhi ukiamka kamkate kidogo hivyo unaenda. Jioni ndio unakaa kabisa ugali na sukuma sijui nini chapati na bonga kabisa unaenda kulala. So what happens? After some time you start adding weight. And Africans generally we like ourselves. Unajua ukiolewa baada ya miezi kidogo unaona bado ile seeds nini unakuuliza kwani your husband anafungia fridge ama and the other side, for the man or zero kwani your wife is not feeding you or what? So we want people who are round the kula vizuri. So it becomes a challenge when you're having intercourse. So imagine una kitambi, mama naye yuko sawa. Sasa unashindwa. You know, it's like having sex with two pillows in front of you. Mzee afiki mahali anatakiwa kufika, mama naye apati what she's supposed to get, so it becomes a challenge. Everybody is frustrated. Ikazi wacha ikaya. So we start having issues with having to remember the way we described infertility. Have intercourse twice or 3 times a week. So if you have these two pillows in front of you, hata kufanya hiyo moja inakuwa ni shida. So unakuta mwezi unapita, nimechoka kazi mingi, whatever, and you're trying to have a baby. You don't have a baby. No, you don't. So lifestyle is very, very important. So quickly about treatment. Treatment in a telemed, when you come, we take a history, and then we sort of try to understand where the problem is. And for the ladies, we need to do some tests, blood tests, look at several hormones. And then we need to check whether the tubes are okay, and then we do a scan to make sure that the ovaries are fine. For the men, it's just one test. Give us a sample. How do we do it? By masturbation, unfortunately. You understand it is an African, we don't do such things, and so on and so forth. Well, you can also do it in a different way. We can give you a special condom, so you can have intercourse, and then you bring it. Not the common condoms ambazo ziko available. Now, depending on what the problem is, if the man has an issue, if the numbers are not there, then we can give some medications so that to increase the numbers for about 2 medications for about 2.5 to 3 months, they come we recheck. If the sperm are not there, then we try and find out what the problem is. Could the problem be because there is a blockage, or could the problem be because there is no production of sperm? Or it can be both as well. So we try and find out. If the issue is with blocked tubes for the ladies, we don't unblock those tubes. For some, the tubes are tiny, and if we try to unblock them, we actually destroy them. So you may end up not having that baby. Or if you do get pregnant, you will have what we call an ectopic pregnancy. That is a pregnancy which is outside the womb. So, what if the tubes are blocked and Then we can do what is called IVF, whereby we give the lady injections for about 10 to 14 days. She produces many eggs because normally a woman produces 1 egg a month. Sometimes they produce 2. That is why we have twins. Right? But in this case, when we're doing IVF, we can actually, she produces many eggs. A young lady can produce 20, can produce even 30 eggs. So we harvest those eggs. We take them to theater and collect the eggs. Mzee anatupatia mbegu. We choose the best of the sperm, and we inject 1 sperm into each egg. We put them in what is called an incubator, and they start growing. So we create a baby in the lab. We create a baby in the lab, and we monitor how this baby is growing, embryo. And by the way, the psalmist says we are beautifully and wonderfully made. Please take that literally, because we are. Where we came from, you cannot see a sperm with your naked eye. You also cannot see an egg with your naked eye. Even under a microscope, it has to be under magnification. About 1,000 times is when you can actually see something tiny like that, and that is an egg. Or a sperm, something which is so tiny. But imagine that in that sperm and in that egg has all the information about us. Atakuwa urefu kiasi gani? Macho atakuwa rangi gani? Where will the eyes be positioned? Atafanana baba yake ama mama yake? Mapua yatakuwa ni mama, yatakuwa ni baba? You know, and so on and so forth. From something which is actually you cannot actually see. So when we create these babies, these embryos in the lab, we now take the embryos and transfer them back into the woman's womb, and we give them medications, and they come after 2 weeks. We do a blood test to welcome the baby shape. And there's so many other things which we can do in order to help couples who are having issues with infertility. We can use what we call donor eggs. We can use donor sperm. We can use surrogates, that is somebody can carry a baby for you, and so on and so forth. So Mungu ametupatia maarifa na tunaitumia. And by the way, if we look in the Bible, Jacob had a problem with infertility. Is it Jacob or Rachel? Rachel had a problem with infertility. So when she saw Leah, her sister is having children, and she's not having children, I hear Jacob, give me babies. Until Jacob says, am I God to give babies? And what about Abraham? Isaac also had problems with infertility. Actually, for Isaac got married to who, by the way? To Rebecca. And they got married when Isaac was 40 years old. By the time Rebecca has children, and Isaac was 60. So it was 20 years of infertility. How many of us here, mothers and fathers, are you going to be tolerant for 20 years? Ati mama atapata mimba 20 years. Hiyo inafanyika kanisani hapana, inafanyika tu nje. Sio? Tunachochea, tunasema tupa huyo nje. In fact, we are the ones who bring another lady and here answer money. Tupa huyo. Atupatie watoto. So it is a problem which is there. We don't want to talk about it because it touches some very, very personal areas. But it is good, asante sana Pastor for inviting me, that we can talk about this in church. We can create awareness. Just by creating awareness, we are starting to solve the problems. And then when we realize that actually this problem is not only mine, there are also other people who are suffering, then it becomes different, and that even if this problem is there, there are solutions to this problem. Thank you very much. Do you have any questions? Oh, there are so many questions. Leo nafikiri tufanye health tu mpaka mwisho.
Kuna za online pia.
So
I'm just going to take them randomly. Can I be put embryo pregnancy if I'm 60 years? If I have uterus, can it fix if my hormones have gone down? I think here we're talking about solving the problem of infertility when a lady is 60. Now, technically, yes. Technically, thank you. Technically, yes, we can actually do that. But then there are other things which we need to look into. If you got these babies at 60, by the time you are 70, is when they are 10 years old. By the time you are 80, is when they are 20. That is if you get to 80. Now, ukienda shule, they say, you know, the kids are very unforgiving. And some of your grandmother has come. Your grandmother has come. Your grandmother has come. So that becomes a challenge. Technically, it's not a problem, but morally, ethically, yes, there is a problem. I can quote a case. A case was in India where the couple, the man was 72, the lady was 70. Wakaikewa, now actually Wakabeba. A month after, what happened is that the mzee landed in ICU. He had a heart attack at 70, lakini watoto tuko miezi. 2 months afterwards, the lady also landed in ICU, also had a heart attack. So who takes care of these children? Yeah. So technically it's not a challenge, but then there are other things which can do. Can one have normal delivery after having 2 C-sections? No, please don't even try. Because mostly what will happen is that if something happens where we cut during the cesarean section, it can actually break apart. And when that happens, believe me, we have 4 minutes or 5 minutes to save you and the baby. So after 2 cesarean sections, don't even think about it. What is the maximum number of C-sections that one can have? I had a friend in the UK who had 5 cesarean sections. So it is not that we advise you have 5 cesarean sections, but the more you have, the higher the possible complications. So please try to limit them. How do you manage backache, pain that starts after having a C-section? That one most probably depends on the analgesia that you were given, anesthesia. Usually we give the what we call spinal, and spinal can later on have issues, but we can sort them out by talking to your anesthetist. Can fibroids prevent one from becoming pregnant? Yes, they can, especially if they're big and they're many, and their location, especially if that location is in the cavity where the baby actually grows. Yes, they can also do that. Apart from that, they can also inhibit or they can stop the sperm from swimming to where they're supposed to go. That is one. And 2, they can also produce some chemicals which can inhibit the implantation of an embryo. Please explain about hemorrhoids. Because men of the moments and what is the cause? Okay, hemorrhoids are basically a swelling in the passage where the stool comes out, and there can be different reasons for that. When women are pregnant, the circulation completely changes because of the pressure that is exerted in the system. So you find actually these ladies, just before they deliver, you find they have hemorrhoids. They can also have, what we call varicose veins as well. So that change in circulation of blood, especially when women are pregnant. Now, for men also can have hemorrhoids. Again, it's because there is a weakness in the walls of the vessels, where a bit more of that blood goes and stays. So when you go to the toilet, you find that you can actually pass stool which has blood on it. Now, when you see blood on stool, please don't think it's just hemorrhoids. That can be a sign for something else. Yes, baby. Thank you so much. Hiyo tutasoma sasa hivi. Yeah. How can I prevent myself from getting blood pressure if it is in the family lineage? There are several things that you can do. Number one, make sure you go for your yearly checkup, or at least once or twice a year. That can help. The foods that we eat, make sure that your weight is okay. Exercise is very, very important. So if all this doesn't work, then maybe you may have to think about medications. What causes fibroids? I think I talked about this. Is the effect of estrogen on the smooth muscle of the womb. Can varicose veins affect the unborn baby? No, they don't, because remember, the baby is in a compartment of its own. So the varicose veins will not affect the baby. Is there a remedy for varicose veins? Yes, there is a remedy. This one. Yeah. The remedy is actually removal, what we call, it's called scaling, whereby a doctor goes in and actually removes these varicose veins. Is that a permanent method? No, it's not a permanent method. There are other chemicals which can be used to sort out varicose veins. Is it possible to achieve a cycle with no cramps? Sometimes some women have cycles which they have no symptoms at all, no cramps, nothing. But some have mild cramps and others have very serious cramps. So it all depends. But if these cramps are a huge problem, then they need to be sorted out. You can give you medications, either with medications which you use throughout the cycle, or medications which you use just before you have your periods. My form is normal and crumpy on the first day, and on the last day. Is there a cause of alarm? No, I don't think there is a cause for alarm. Let me answer this. Can someone have children if he has only one testicle? Yes, you can. That is why God created, some of the organs are in pairs, 2 ears, 2 eyes, and so on. Yes, you can, so long as it's functional. Causes of yellow discharge from the vagina. This, so long as it is not itchy, it is not painful, it is not smelly, you need not worry about it. What is the best age for a lady to give birth? Now, that is an interesting question. Rule of thumb is the younger the better. Why? Because the older and the very young usually have issues with high blood pressure, issues with diabetes. If it's a young lady, 12, 13, 14, 15, the youngest girl who has ever given birth, I think it was 7 or 6 or something like that. How she got pregnant, I have no idea. What this man was doing there, God forgive him, and I'm not Yeah. What makes a man in polygamy to have erectile dysfunction? Erectile dysfunction is not connected to polygamy. Erectile dysfunction is basically that your organ is not doing what it's supposed to do when you want it to do it. You want to have intercourse, but then in a catarrh. You want to have this in a catarrh. So that has different reasons, and the reasons can be very many. Most of the time, it is psychological. Most of the time, probably you have pressure at work, and so on, and mama and trying to find a ngono, and then you say, no, I can't. If you have pressure at work, you have pressure at home, for example, you will have issues with erectile dysfunction. But that notwithstanding, there can also be so many other reasons for erectile dysfunction. Diseases like high blood pressure, what is it called? Diabetes. Some of the medications that we take for other reasons altogether. Some accidents as well, some tumors as well, and so on and so forth. So erectile dysfunction has a huge spectrum. Prostate, enlargement of the prostate, especially with age, this will lead to erectile dysfunction. So we need to find out what the reason is. The reason is not polygamy, absolutely. Treatment of hemorrhoids, most of the time it's surgical, but sometimes you can use some medications which make the stool softer so that it can come out easily. But if that does not help you, then we have to do it surgically. Is family planning next one to have fibroids? If yes, which type of family planning is best? A completely huge topic when you talk about family planning and contraception. So answering the question, family planning does not lead to fibroids, does not cause fibroids. About the issue of which family planning is best, this is individual. There are ladies who are okay to swallow tablets systematically daily, and there are ladies who can just not do that. And there are ladies who they say, you know, me, I can't imagine something being put in my womb. So it all depends. But we have a wide array of family planning methods which can be used. Some which are long-acting but reversible, some which are permanent, and others which are, very easily reversible. So it all depends on what is best. What is best for
Dr.
you.
As a follow-up, someone asked on our online viewers.
Yes.
Someone asked the same question, but also asked about P2.
About P2.
Yes.
P2 is actually not family planning. P2 is meant as an emergency, and I mentioned that, and I mentioned today as well. It's an emergency, something that happens. Mzee amekuja, hamjaona na siku nyingi, but you don't want to have a baby, and imetendeka. So what do? You panic and say no. Then I can use this. But by and large, it is not a family planning method.
It doesn't cause fibroids. That's the question.
Sorry.
Can it cause?
No,
fibroids?
it does not cause fibroids. It does not cause fibroids. I have a problem with my stomach when my bladder is full. My stomach enlarges a bit. But when I read myself, my stomach comes to normalcy. Is it a sign of fibroids? No, it is not. It is not. So we need, in order for us to make sure that there are no fibroids, we need to come, we do a scan, and then we can confirm. Once diagnosed with fibroids, will they disappear after childbirth? Actually, during pregnancy, what happens is that there is a lot of blood flowing into the womb in order to feed that baby, give the baby oxygen, give the baby nutrition. Now, remember these fibroids, if they're there, they will also take part in this, this blood that is flowing. So you find in pregnancy, the fibroids are going to grow. During delivery, if it is a cesarean section, we don't touch a fibroid because you can actually bleed to death because of that. So, do they disappear? Usually they don't disappear after childbirth. They actually just, reduce their size because not as much blood is flowing as when one was pregnant. When someone goes for a long call and experiences pain and has some bleeding, does it mean a possibility of fibroid? Not necessarily. This can mean several things. Number one, we don't want you to have colon cancer. And I repeat and I underline, when you go for a long call and you see blood on the stool, please go for assessment. This is what we call occult blood, which is there. Please go for assessment. We need to put a pipe through that opening, and then we see whether something is growing there. So please, obviously, the blood can come from other regions. It can be a hemorrhoid, for example. It can be because the stool is tough, so when it's coming out, it scrapes through the rectum. It can also be because of other things. But the first thing that we want to make sure is that it is not colon cancer. How is endometriosis treated? Endometriosis is a completely different, again, very, very huge topic. About 10% of women who are at the reproductive age and are having issues with getting a baby actually have endometriosis. What is endometriosis? Ladies, when you have a period, what comes out is basically what you call the lining of the womb, basically where the baby is supposed to implant. Now, if that implantation does not occur, then that lining comes out. Ideally, all of it should come out, but sometimes because of some mechanisms which you don't understand, we find bits and pieces of that lining get stuck outside the womb. They can get stuck on the ovaries, they can get stuck on the tubes, sometimes they can get stuck in the intestines, and so on and so forth. A friend of mine had a young lady who had endometriosis, and she was bleeding. She was bleeding from the ears leading from the palms as well, and so on. A very, very unique case of endometriosis. How is it treated? You want to find out, first of all, how far it has spread. And you can do that by doing what is called laparoscopy, having a look inside the abdomen, and treating it first. Once we have treated it surgically, we can come back with medications. But sometimes, if it is mild endometriosis, we can start with medications first. But the story that you give us, that is why the cycle is very important, because that information that you give us will actually give us an insight on whether we are dealing with endometriosis or we are not dealing with endometriosis. So we can deal with endometriosis medically by using medications. We can also do surgically, or we can combine both. I am a lady with 2 children. Most of the time after doing my washing, I experience a lot of pains on the lower back, that even lifting heavy thing is a problem. Kindly advise, the pains can go for more than a week. We need to find out what is wrong with that back, and the best way that you can do that is by doing an MRI of the lower back. That is the most accurate. When you find a picture X-ray, the X-ray may give us some information, but an MRI of the lower back is the most important, and that will give us insight on what it is and how we can deal with it. Can masturbation affect the production of sperm? Which one gets, or when one gets married, or can it prevent one from giving birth? A very, very important question, especially for the young ones who are here with us. Masturbation is a big problem. Not only for the young ones, but also even for some of us who are married. There are so many reasons why women also masturbate. It's not only men, by the way. I'm saying now, unfortunately, this is something which sometimes can come in as automatic, especially when our bodies are, starting to adopt to adulthood, when the hormones start bubbling, where now you're starting to produce sperm. The first thing we have is wet dreams. That's sort of thing. It happens. Women also do the same thing. Wake up also, you also have wet dreams as well. It is something which happens. Now, when it comes to masturbation, unfortunately, this is something that you're doing with premeditation. You want to pleasure yourself, by doing, whatever it is. Masturbation, just like alcohol, just like cigarettes, just like anything else, is an addiction, or can lead to addiction. For sababu gani? That pleasure that you feel after doing that, it actually affects a part of the brain which releases dopamine, and you feel, wow, that is nice. And then later on, you also want that to release again, and you do it. So it becomes an addiction. Just like somebody who's taking some alcohol or taking some drugs and so on. It can be a challenge later on when you get married and you want to have children. Why will it be a challenge? Because you may find your husband is not satisfying you as much as when you used to satisfy yourself. Number one. So unafanya ngono mkimaliza, akienda kazini, or when you're in the bathroom, that is now your time, as it were. So you really, get to what you're supposed to get. The same with men. So it can and it will affect your sex life. So be careful about it. The same with pornography. Najua tuzungumzia mambo kanisani. Whenever we are holy, we don't talk about these things. Simple. But they are happening in our homes, and they are happening here. So you find, you watch pornography and you get addicted to pornography, and when you're watching, you look at these beautiful women, whatever, and these men who are muscular, ukiangalia wako na shindo walo, kwani yuni nitoa wapi. So later on, you try to think, now I should be getting that satisfaction from this command, and he's not giving it to me. Or this, my lady, one you go in, they have big boobs and they have this and wanakila kitu, so it becomes a problem. So pornography and masturbation usually go together. yes, they may not affect the production of sperm, but they can affect your normal sex life and possibility of having a baby. Can the regular monthly periods be a sign of fibroids? Not necessarily, but heavy periods with clots can be a sign of fibroids. What about regular abdominal pains, especially after sex? Not necessarily, but if there is bleeding or spotting after intercourse, please see a gynecologist. What about full lower abdomen? What about painful nipples? When the nipples can be painful, especially before the periods. Why? Because of the hormonal changes that take place in the body. Because the hormonal changes are basically there for pregnancy, but the breasts are also being prepared for that baby to start suckling. So if the baby is not there, there's no implantation, then everything comes out, and the boobs also become less painful, less sensitive, and the cycle starts all over again. I usually feel pain on my left breast. It comes and goes. Could it be breast cancer? And not necessarily. You need to have it checked, and the question is, do you check it yourself, first of all? Because ladies, you are the ones who should know how your breasts feel like. And you can only know that by checking them on a regular basis. That is one of the questions that we ask. Do you check your breasts on a regular basis? If you do it on a regular basis, in the pieces of paper that I showed you, you will have an idea. My breast at this time of the cycle feels like this, but this has not been there. This has not been there. Then you can come and say, Daktari, I noticed, I've been checking my breast, and I noticed something there. But when you come and say, Daktari, check my breast, we'll check, but we actually don't know your breast. You are the guys who know. So please make it a point of checking your breast, because then you'll be able to catch issues which are there. With breast cancer, by the time you actually see that change on that breast, that the skin is changed, it looks like an orange skin, or the nipple is inverted, or there is greenish whatever coming out, that breast is full. It's already late. It's late. So please check your breast on a regular basis. What's the best family planning method? How do we prevent fibroids? Fibroids are difficult to prevent. Best family planning method is individual. There are many types of family planning I mentioned, and they vary. Some of them, you're satisfied with using CDs, which is okay. Some of us are okay with using pills, which is fine. Others are not okay with using pills. Some of us are okay with an implant. Others are okay with a coil, and so on and so forth. So there is no one method that fits everybody. It is individual. What is the relationship between fibroids and endometriosis? There is no relationship. Fibroids are different. Endometriosis is different. The pathology is different. Fibroid is a growth on the womb or in the womb. Endometriosis is the lining of the womb finding itself outside the womb and behaving exactly like the lining in the womb. Meaning what? Meaning at the beginning of the cycle, the lining is thin, so where this endometriosis is going to be small. As we continue in the cycle, when you get to mid-cycle, the lining in the womb is going to be thick. Whatever is outside the womb is also going to grow big. And then that is when you start having pain and so on. And once you have a period, again, the lining becomes thin, whatever is outside also becomes small. So that is the way it works. So there's no relationship. After surgery, what are the chances of the endometrium growing again, and what are the remedies? Now, depends on what type of surgery has been done and why we are doing that surgery. If the problem is heavy periods, we can actually remove the endometrium completely, that lining. And if you have the right number of children, we can actually do that. And then you will not have the heavy periods, but of course you will not be able to have a baby. If the issue is, let's say, a fibroid which is inside the womb, we can remove that and give him medications for the lining to grow. So we can help that lining to heal such that you can have a chance of having a baby. Kindly elaborate on side effects of full anesthetic cesarean as compared to half one, and which one is better. The one which is better is the half one any day. Why? Because we are in contact with you. you will feel, no, you will feel touch, you will feel pull, but you will not feel pain. Now, when it is advantageous to the baby, most importantly, because it just stops the nerves from you feeling pain. As opposed to the full one when you go to sleep. It doesn't mean that we don't use a full one. Yes, we do sometimes. We can do that, but when we use that full one, we have to be ready. I have to be ready. I have cleaned you and everything, I'm just waiting. So immediately the anesthetist give you the information, the anesthesia, I have the knife ready. I can decide to train them, and I have to do that very, very quickly. I have maybe a minute, 2 minutes to be able to get inside the womb and get that baby out. Why? Because that medication for you to sleep will also get into the baby. And we don't want it to get into the baby because the baby can come out equally. You know, that is why we don't like the full one. We prefer the half one. But in cases whereby the half one is not possible, then we can use the full anesthesia. And then apart from that, we want to see how the patient is all the time, such that we can talk to the patient, we can actually even show the baby to the patient, and so on. So that is safe, and it's safer than the other one. So, and again, it all depends the expertise, but now I think practically every anesthesiologist can safely give the half one or the spinal. Do you know what is it? Yes, there's a question from one.
Yeah, what is uterine prolapse, and can one be pregnant with the condition?
Okay. What is uterine prolapse, and can one be pregnant with that condition? Now, ladies, your womb is inside what you call the pelvis, and it is anchored there by what we call ligaments. Now, depending again on, again it's individual, there is what we call collagen fibers. It's a protein which makes our structures either stronger or weaker and so on. With the number of children that we deliver, and especially if the children are big, the babies are big, 3.5, 4 kilos. I've met women who have delivered 5.4 kilos, and I wonder how they did it. Women, you can do anything. 5.4 kilos, anyway. Now, what happens is, once you have delivered, remember, actually the womb, the womb which is not pregnant is about that big. It's not actually that big. It's about 100, 140 grams. But imagine that this is what grows and expands and carries a baby 3 kilos, 3.5 kilos, sometimes with 4 kilos, and sometimes there are 2 of them inside there. It's absolutely amazing. Amazing. Now, once you have delivered, what happens? There is a mechanism which is activated, and especially when you're breastfeeding, you may feel a bit of contractions. That is actually normal, because then that womb starts going back to where it was. So imagine that you deliver 2 children, 3 children, 4 children, 5 children, 6 children, and so on. Now, what about kilo tatu, na nusu, kilo nne, and so on and so forth. What you call the suspension, because the womb actually is suspended. So those ligaments become weak. So instead of the womb being up there in what you call the pelvis, it starts coming down. So it starts coming down. Sometimes the whole of it can actually come out completely. So we have a complete prolapse of the uterus. So what we do sometimes when such a case happens, the patients will come and say, even going for a shortfall is a problem. I have to push it back in so that I can be able to urinate. Can somebody deliver? Can you carry a pregnancy in such? No, you cannot. We will need to do some surgery to push it back and fixate it, and then thereafter you can get pregnant. Now, can you deliver vaginally after such an operation? It is not allowed, because then delivery is work, very heavy, hard work. Ladies. Ile kazi unafanya, it is out of this world. And I can tell you something. If it is us men who are to deliver, hata Mungu atuleza. Just to show how confused people are. In February, they managed to do what is called a uterine transplant. They removed one womb from somebody and gave it to somebody. And then one of the professors who did that says now, with this technology, we are able to transplant this to men, and men can carry babies. Excuse me? Are doing what they are getting themselves into? They have no idea. Kwa maana mama akibeba mimba, that baby actually colonizes that body. Anaingia kila mahali. Kuna mahali anagusa mwana, anasikia anataka kupiga nduru lakini hawezi kupiga. Ati alafu mimi anaruka nduru. Hata siku moja. Wengine wazungu, but hata wazungu hawezi, I know. So it is not possible until it has been sorted out. Then carrying a baby is not possible. What can cause miscarriage? Now, miscarriage is basically when a lady gets pregnant and loses the pregnancy before 20. In this part of the world, we say before 25 weeks. In other parts of the world, we say before 22 weeks, or up to 22 weeks. There are very many reasons for miscarriages. Number one, we can start from if the embryo is not okay, and there are mechanisms. God has put mechanisms in the body such that whatever is not okay is actually thrown out. Can you hear me? Okay. So, one of the reasons is that the embryo is not okay, the baby is not okay. You can also have problems with infections, problems with high blood pressure. Remember, when that baby implants inside the womb, the vessels have to open up so that they can pass nutrition and oxygen and so on. So if those vessels are constricted because of high blood pressure, you're going to have a problem in getting pregnant and carrying that pregnancy to term. You may have issues with miscarriage. If the cervix is not okay, because you may have other issues, you've had some procedures, the cervix is not okay, inafunguka mapema, so you lose the baby. Infections can lead to the waters of the baby breaking and losing a pregnancy. Your immune system, what protects you from viruses and bacteria and so on and so forth. If it is not working well, you may end up actually losing babies, at a certain age. Your hormone levels, for example, TSH, thyroid stimulating hormone, very, very important hormone. If it is elevated or if it is low, you may not get pregnant, or when you do get pregnant, you may end up losing these babies. Diabetes, sugar, that extra sugar is actually toxic to the baby. So there are so many reasons why the fibroids that we talked about, the endometriosis that we talked about, polycystic ovaries that I mentioned, and so on and so forth. So we may not be able to exhaust the reasons for miscarriages. Fallopian tubes can't be unblocked. No, I said they can be unblocked, but once they are unblocked, in the process of healing, they block again. So I normally do not unblock tubes because it doesn't make sense. And then apart from that, inside the tubes, there are some very, very tiny hairs which actually help to push the embryo for that matter, and the egg and the embryo into the tube, and later on after fertilization into the womb. So if they are blocked, most of the time we find that structurally they are actually completely destroyed. So they will not help. So when you hear about an ectopic pregnancy, most of the time is because there's a problem with the tube, and the problem can be a blockage that has been opened, or the tube is stuck and it's not doing the work it is supposed to do. Okay? What about the test in hospitals? Can't you remember the name whereby a dye is injected through the vagina, which runs through the tubes? With the dye pressure, the tubes are unblocked. Yes and no. The dye test, as we call it, is basically to see A, whether your tubes are open, and B, if they are not open, where is the blockage. Sometimes, if the blockage is flimsy, very, very thin, adhesions, sometimes that pressure can actually relieve, those adhesions, and you may end up becoming unblocked. But that it does not happen very often. And again, it depends on where the blockage is. If we imagine that my hand is actually a tube, and my body is actually the womb. Sometimes you may have the blockage right here where the tube joins with the womb. To open that is very complicated because of the blood flow and the vessels which are there. And then suturing it back is almost impossible. And then the blockage can also happen on any part of the tube, as it were. So we have to be careful about that. Yes, it can happen sometimes when we're pushing that die, but it's not very often. Is it healthy to have sex while pregnant? It depends at what stage. Usually, if there have been problems in the past, if you've had issues of losing babies or losing pregnancies, if you've been having issues of bleeding during pregnancy and so on, we say, wacha kuwena nanja, wacha mzee akae hivyo, because unasikia where because having intercourse, especially unprotected, because you're not having time, in the sperm, there are chemicals which actually can irritate the cervix and make it ripe. And usually if the pregnancy has gone past the time you're supposed to deliver, and then after a day or two, unakuja with contractions, because that sperm has some chemicals which help the cervix to get ripe and to start contractions. Does that mean that you can't have sex when pregnant? No, it doesn't. And there are some women, actually, when they're pregnant, they want to attack your cousin's son. It happens very much. So, if there are issues, then we say abstain. But if there are no issues, it is okay. You can have sex. It will not affect the baby. Is withdrawal method sure as family planning? No, it is not even a family planning method. By the way. It is not even, I don't even consider it as a family planning method. What's our planning? Now, just before a man reaches orgasm, some little fluid can actually come from the penis, and in that fluid there can be sperm. Yeah. So you kusema mzee sasa toa gari. Unakuta gari imeenda imepita stage inaenda. So it's not even a method. Don't consider it a method. Even though some circles actually say that is one of the methods of contraception. It's not. After family planning, which medicine can one use when she wants to get pregnant? After family planning, usually once the cycle has come back, you can try getting pregnant naturally, or that is number 2. Or we can use some medications to enhance the process of you trying to get pregnant, so that you release either one or several eggs, which can help you in getting pregnant. I usually feel pain during my periods. I feel extra pain on my lower back and abdomen, and the pains come even when I'm not on my periods. I've gone to the hospital and I was never told clearly what it was, and even after medications I felt worse than before. What could be the problem? Many problems. The problem could be endometriosis, it could be adhesions, it could be cyst, it could be anything. So you need, we may actually need to take you to theater and put a camera inside the abdomen. Then we can actually see if there are any problems there, and if there are problems there, we solve them. Remember, the problem can also be from the back. So lower back, lower abdominal pain, pains can also start from the back and radiate to the breast. Can our bras cause breast cancer? No, they will not cause breast cancer. Tunamalizia? That is the last question, I think. 5 more. So easy, like only half a minute. There was time I used to swim daily, like I would do 20 strides daily horizontally. Then I started bleeding frequently after 1 week. Could it be because I had a cesarean birth like a year ago? How long does this birth take to heal? Cesarean birth or cesarean delivery, if you're talking about the healing of the wound, 6 weeks you've healed completely. But we don't want you to get pregnant because you heal after 6 weeks. We want you to spend time with your baby. We want you to, give that baby some time and so on. So we don't want you to get pregnant after a short period after cesarean section. The bleeding, could it be because of cesarean section? I don't think so. There could be another reason. If a man stops engaging in sex after 40 years, can he have prostate cancer, and what causes blockage in men? Actually, they say there's some studies which have been done which show that the more frequently we ejaculate as men, meaning the more often you have sex. Remember we talked about ladies loving sex. Make your women love sex. It is okay. Nasikia kuingia kwa kitanda mnajifunga kabisa mtaki kuonekana. Now, does it mean if you stop having sex at 40 years, there are higher chances of you having prostate cancer? Not necessarily. There can be other reasons as well. Your diet sometimes, if you do exercise and so on. But sex per se as a reason of prostate cancer, no. Usually enlargement of the prostate comes with age. So we need to check that. Can getting pregnant and delivering a child serve as a natural remedy for fibroids as opposed to operation and removal? Not necessarily. Remember, we say that during pregnancy, the fibroids will grow because of the amount of blood that is circulating there. But having a delivery, will that remove the fibroids? No, it will not. The fibroids will just reduce the size and shrink a bit, but will not get rid of them. Right, we're having fibroids because I have heavy cramps and I'm about 50 years. If you have periods at 50, that is okay, and the cramps may be suggestive of fibroids, but in order for us to confirm that, we need to do a scan. If a person has periods twice in a month with serious cramps, what can be the cause? The cause can be hormonal, or it can be something else. It can be a cyst on your ovary, it can be fibroids, and so on. So we need to find out what this is. 2 periods in a month is not normal. What can be the reason for a woman stopping her periods at 40, but without menopausal symptoms? What can be done if she still wants more children? Many reasons can be there can be many reasons for the periods stopping at 40, sometimes even before 40. I've had patients who are 18, 20, and they have irregular periods. And when you check their hormone levels, you find their hormone levels are like a woman who is maybe 50 or 60. What we call premature ovarian insufficiency or premature ovarian failure. What can be done if she wants to have a baby? We need to find out exactly what the problem is, and then we take it from there. IVF can be one of the solutions using donor eggs. Mtu akisikia mimba itoke aoshwe, mbona most of the time hawashiki mimba tena? Very good question, by the way. Kuoshwa, it depends on how it is done. If you have several miscarriages and you go and you are cleaned, as it were, if it is done in a very vigorous way, we remove the lining completely, and then when the healing process starts, we have things growing there, what we call adhesions. So you have very light periods or no periods at all, and then because an embryo must implant on the endometrium. So if that endometrium is not there or it's not functioning well, there will be a problem with getting pregnant. Kindly explain the correct age for menopause. What makes a girl of 26 years to get to menopause? 26 years to get to menopause is a tragedy. It can also be, unfortunately, it is a tragedy. It can be because most of the time, 2 or 3 reasons. Reason number 1, either you had surgery on the ovary or ovaries, and when we're removing whatever was growing there, we remove it with a lot of normal ovarian tissue, and this will lead to you not having periods. So you have premature menopause because of that, because the ovaries are not functioning the way they should. Some of the medications that we take, for example, if that young lady is taking chemotherapy or radiotherapy, of course, unfortunately, the ovaries will not be working the way they should. If you have some infections of the ovary can actually kill the cells in the ovaries, can also lead to premature ovarian insufficiency, or sometimes it is in the families. So I don't know the reason why, but we need to see her and find out. Could circumcision lead to infertility in men? No, circumcision does not lead to infertility in men. In women, can it lead to infertility? Not really. But there are different types of circumcision. I think that's the last question. There are different types of circumcision. And ladies and gentlemen, I think we come from societies where we think that our girls have to go through a certain ritual, and we have to cut a little bit of what we call the labia majora, or even the labia minora, in order for them to be grown up. So those ones of us who read the river between, we know what the conflicts were. That this one is uncircumcised and this one is circumcised. So the ones who are circumcised feel they are better than the ones who are uncircumcised. Let me tell you, we had a lady during our congress. It's the last. Give me 2 minutes. I'm finishing. We had a lady who came to our congress of gynecologists this year in Mombasa, and she gave us a horrible story. She comes from either Marsabit or Isiolo, I can't remember the place. She had circumcision when she was 6 years. How many? 6 years. Why? Because that society feels that girls should be circumcised at that age. So she got circumcised at 6 years. Then at 12 years, the mother looked and said, we went back in, and guess what they did? Wakakata yote, what we call infundibulum, where they removed everything from the clitoris, from the clitoris all the way, they removed the labia majora, the labia minora. So it became flat. And now because she's bleeding, and you know they're doing this without any painkiller, no anesthesia, nothing. You know what they did to hold the tissues together? They took thorns. Neighbor, they were ishikilia so that the tissues can be whatever. She was in bed for 1 month, and a miracle happened that she did not get infected and that she would die. Circumcision. Wakisi. Hey. Wakuria. Wakaba. Yeah. But there are other societies who actually do a horrible job. The Maasais also do that. The Somalis actually do that. And the other societies. It is not something that is good, but it's something that is cultural. What happens to these women when they get pregnant? You're asking whether circumcision can lead to infertility? Not necessarily, but there are other problems which come later on, especially when it's done like that. These women do get pregnant. They have a big problem when they're going to deliver vaginally. And then they have this belief that a woman must deliver vaginally in order to be a woman. So you find the capacity is that small. Because what they need is just a tiny passage for the lady to just pass urine. So you find the head, which is 10 centimeters, cannot in any way pass through them. So there are adhesions and there are complications. So you find that these women labor for 2 days, they labor for 3 days, sometimes 4 days, can't move. What happens is the baby dies inside the womb, and then they have other problems, what we call fistulas. So you find the urine is coming out, or sometimes even the stool is also coming out because of what they're going through. So circumcision per se does not lead to infertility, it leads to other complications. And it's number 4 actually in what you call the big 5. What kills our women? Our women who come to deliver die because of bleeding, what we call PPH, is number 1. Number 2, blood pressure, what we call preeclampsia, is number 2. Number 3, what you call post-abortion complications. Number 4 is sepsis. And number 5 is obstructed labor. So it's one of the big 5 that actually affects our women. My phone number, somebody asked for my phone number. There's an office number, 07, very easy to remember, 0780, and then 170, 170. That is the office number. 0780, 780, 170, 170. The one which is there is my personal one, 0708 051 799. That is my personal one. And I'm located at, sorry? Personal. Then share with you, 708 051 799. So, thank you so much for giving me this privilege of talking to you. And thank you for listening to me. I'm so grateful. Location, Gong Road. Gong Road, 5th Avenue, 5th like 5. 5th Avenue offices. 3rd floor, 314. Magari ni kutoka town, kutoka Kencom, unashukia traffic headquarters ya Nairobi. Where's the kupatia? Ukifika traffic headquarters, you just cross to your right. You'll see new life, yeah, absolutely new life. So,
Amen.
Asante sana. And my apologies for coming late, and my apologies for taking too much time.
Amen.
Asante sana. Thank you. Thank you.